You're joining this live Tele-Town hall with Congresswoman Terry Sewell, and we're going to dial out to Alabama's 7th Congressional District right now. We're going to be getting our live forum started in just a moment here. Congresswoman Sewell's assembled a panel of public health experts and state leaders to help answer your questions and give you updates on the COVID-19 crisis and the response. And so we're going to be hearing from each of those speakers in just a moment here. But we'll also have a lot of time. We'll spend more than half of our time on this hour-long forum taking your questions. So for those of you in the listening audience, if you have a question that you'd like to submit for Q&A, you can do that now or at any time during the forum just by pressing 0 on your phone. Again, you can press 0 to submit a question for the live Q&A portion of our forum. We'll be getting to that in just a moment here, but again, we have a panel of public health experts and state leaders on the line first. And we're going to be hearing from each of them with some updates and some important information. So as you're listening to those updates and the important information we have, first you might grab a pen and paper just to write down anything important that you hear. Second, think about questions you want to submit for Q&A. And as soon as you have a question you want to submit for Q&A, just go ahead and push 0 on your phone. You'll speak to an operator, give them your question, and I'll be reading your questions over the air throughout the call. So again, you can just press 0 to submit a question. We'll get our updates from our public health experts and our state leaders who have joined us on this panel today to answer your questions. And while you're listening to those updates, just think about questions you want to submit. As soon as you've got one, press 0 on your phone. And when you press 0, submit that question to one of our operators, and I'll be reading your questions and getting them answered by Congresswoman Sewell and by our assembled experts and state leaders. So again, all you need to do to get into the queue is press 0 for Q&A. We'll be getting to that after some updates and information from our panel. But remember, pen and paper are really useful here too, because you'll be hearing a lot of information from all of our featured speakers, whether they be public health experts or state leaders. They'll have a lot of important information for you, and this is your opportunity to take it down and learn more. And of course, as soon as you have a question about anything, press 0 to get into the queue. You'll have an opportunity to submit that question to an operator, and then I'll be reading your questions when we get to Q&A. So I'm going to go through this information once more, and then I'll be turning it over to Congresswoman Sewell. Again, thanks for joining this live Tele-Town hall. Oh, thank you, Congresswoman. We're just about done dialing out to your 7th Congressional District now, Congresswoman. So let me remind everybody that we'll have some updates, some great information for you, accurate information. As you're listening, you may grab a pen and paper to write down important information. Also be helpful if you're thinking about questions you might like to ask for Q&A. We'll spend a lot of time on Q&A today, so press 0 to submit a question at any time. I'll be reading your questions during Q&A. We'll be getting answers from Congresswoman Sewell and from her panel. So with that, Congresswoman Terry Sewell, please take it away.
Good evening and welcome to Congress in Your Community Telephone Town Hall for Greene, Hale, Perry, and Sumter counties. I'm Congresswoman Terry Sewell of Alabama's 7th Congressional District. As you know, each year I host a Congress in Your Community town hall tour through all 14 counties in our district. Because of the coronavirus guidance on social distancing, our normally scheduled in-person town hall tour has been restructured to this telephone town hall format. We remain committed to engaging in meaningful conversation with our constituents, and our new normal will be these county clustered telephone town halls, and this will be our first, specifically for the constituents of Greene, Hale, Perry, and Sumter counties. So welcome. Today we will focus on the coronavirus and also provide information on the 2020 census. We will leave time to answer questions of importance to you and your family. It has been 18 days since March 13th when the first case of COVID-19 was reported. Today, on March 31st at 3:30 p.m., there were 979 cases reported with 13 confirmed deaths. With respect to the 4 counties, there were 3 reported in Greene County, 1 reported in Hale, 0 reported in Perry, and 1 reported in Sumter. This coronavirus is a very serious crisis that is accelerating every day. In these sober times, we must lean on our Creator for wisdom that knows that which we cannot understand, and for faith that will see us through. Therefore, I thought it was befitting that we started this hour with a word of prayer. I'd like to welcome Pastor Kyle Searcy to start us off with an invocation. Pastor Kyle.
Thank you so much, Representative. Thank you so much for all that you do and being a voice to us in this hour. Let's pray. Father, we thank you because you are an arm we could lean on in difficult times. We thank you because you're very present help in times of trouble. God, we ask for your wisdom, your insight, your guidance. Lord, we ask you to speak to us and lead us in this hour. Show us what we need to do. Let us hear what we're not hearing. Let us see what we ought to see. We ask, God, for these counties and the representatives of these counties, Greene County, Hale County, Perry County, Sumter County, that you bring help, you bring aid, you bring the comfort of your spirit, and that you're with us in this time and in this hour. We ask it in Jesus' name, and we thank you for hearing and answering our prayer. It's in Jesus' name we pray. Amen.
Amen. Thanks, Pastor Kyle. I know that
You're
right
welcome.
now it's scary and confusing time, and unlike anything we've ever experienced. It's a really difficult time, and we must take serious this crisis that we're in, but remain calm enough that we can prepare for the crisis for ourselves and our families, and calm enough that we can aid others in their need as well. But we have within our power to practice social distancing and personal hygiene, and we should heed the CDC's guidance. I thought I'd begin this town hall by talking a little bit about the federal response to this unprecedented time that we're facing. Congress has passed 3 bills to address this crisis. The first bill was an emergency funding package of $8.3 billion at the beginning of March. That funding committed more than $3 billion to the development and treatment of a vaccine and a treatment for the coronavirus. It provided $2.2 billion in prevention and preparedness and response measures to our states. In fact, the state of Alabama received approximately $13 million already. The second bill, passed on March 13, 2020, was called the Families First Coronavirus Response Act. That second bill ensured free coronavirus testing for everyone, irrespective of whether you get your insurance privately through the federal government or you have no insurance at all. It also provided 2 weeks of paid sick leave and up to 3 months of family leave for eligible workers and enhanced employment insurance. This Friday, Congress passed the third bill, the Coronavirus Aid, Relief, and Economic Securities Act, the CARES Act. It provided for direct payments of up to $1,200 for individuals that make $75,000 or less, and an additional $500 per child, thus ensuring that a family of 4 would be eligible for $3,400. It provided for a federal unemployment compensation of $600 a week for up to 4 months for those eligible for unemployment, which is a huge investment in unemployment insurance benefits, which we hope will match the average paycheck that laid off or furloughed workers would have received. In addition, the bill expanded unemployment insurance to include the self-employed and gig workers, and we secured an additional 13 weeks of federally funded benefits to be made available immediately. On top of all of that, we also secured in this bill $10 billion for SBA emergency grants of up to $10,000 and making payroll costs, rent, mortgage interest, and utility costs eligible for SBA loan forgiveness. This is the first time in history that we've done that. We also fought for and won $200 billion of investment in our hospitals, our health systems, and health research. Also, $150 billion for state and local governments in this agreement to give them the resources that they need to deal with this emergency. Indeed, this last bill was a big stimulus package for hospitals, for workers, and for American families. It totaled $2.2 trillion. Unprecedented times require unprecedented federal responses. My office has received an unprecedented number of calls about the direct payments, or what some are calling the stimulus checks. I thought I would address briefly before closing the 2 most asked questions. How do I get a check, and when will I get a check? The law provides that individuals making up to $75,000 or $150,000 for married workers will receive payments of $1,200 with an additional $500 per minor child. The payments decrease ratably and stop altogether for single Americans making more than $99,000 or $198,000 for married folks. These benefits will be issued by the Internal Revenue Service, the IRS. For most people who file taxes, they will receive a direct deposit. They will receive their benefit through direct deposit or by the method of payment as indicated on your 2019 or your 2018 tax return. Social Security beneficiaries for retirement, disability, and survivorship, and SSI recipients are eligible to receive the direct payment. Social Security beneficiaries who do not file tax returns in 2018 or in 2019 may need to take additional action, such as filing an abbreviated tax return to receive the direct payment. This process is still evolving, and the IRS is posting specific guidance on those who do not file tax returns on how to get and receive their direct payment. You can go to irs.gov/coronavirus. Low-income taxpayers, senior citizens, Social Security recipients, some veterans, and individuals with disabilities who are otherwise not required to file a tax return will not owe taxes. This form, abbreviated short form, will only be for those to get the information needed to receive the direct payment. While this additional action that is required for those who do not file tax return is burdensome and not exactly what I would have done, it is the law of the land for now. And for further guidance, you can go to my website at sewell.house.gov for updates. The Department of Treasury estimates that these direct payments will be delivered in 3 weeks. Please again check my website, sewell.house.gov, for updated information. Now, as we work together to ensure that our district is adequately provided for, I would also ask that each and every one of you to make sure that you're following the CDC guidance for your own health and well-being and for the health and well-being of our community. When we talk about stopping the spread of this disease, we often talk about flattening a curve. All that means is that the more we practice social distancing and our own personal hygiene, the better off we as a community and we as a state will be. As best you can, please self-quarantine and make sure to keep 6 feet between yourself and anyone who you may come in contact with. Please do not gather in groups larger than 10 and make sure, even within the 10 persons, that you're practicing social distancing. Please continue to wash your hands regularly and wipe the surfaces frequently of objects that you use often. Remember that even if you are not currently displaying symptoms, you may be a carrier. During these times, we must be worried first and foremost about our most vulnerable in our society. Finally, I want to encourage you to reach out to your community and to your loved ones over the phone and over the internet. I think it's critically important that we stay connected even though we're staying and practicing social distance. We must all work together to fight for who we are as a people, a community that stands together in times of storm. With that, I'd like to introduce our first speaker tonight, Dr. Samantha Hale from UAB Hospital and the Children's Hospital of Alabama. Dr. Hale, you're up next.
Thank you, Congresswoman Sewell. Good evening, everybody. I just wanted to provide a quick national overview of what's been going on with COVID-19. Currently, there are more than 184,000 cases that have been confirmed of COVID-19 in the United States. Approximately 2.1% of those cases have resulted in individuals that have passed away. And the epicenter for the epidemic within the United States remains New York City, but it's important to understand that additional hotspots are starting to emerge throughout the country. It's also important to understand that the numbers that I just mentioned are really confirmed cases, and they may actually be higher because we're not necessarily testing everybody. COVID-19 is predominantly spread through droplets in the air, which means sometimes when you cough or when you sneeze, you release droplets that can land on surfaces or land on another person. And even though that's the primary method of how it's spread, it's important to also understand that we do know that COVID-19 can remain alive on surfaces for a few hours. When we're thinking about what are the symptoms of someone that might be displaying symptoms at all of COVID-19, it's important to understand that fever, cough, and body aches as well as maybe some headaches are the main symptoms. But I must emphasize that everyone that has COVID-19 doesn't necessarily initially present with a fever. So it's really important that you discuss with your healthcare provider if you're feeling any symptoms at all. Many individuals, additionally, that are living or infected with COVID-19 may be completely unaware that they are infected because, as Congresswoman Sewell mentioned, they may not be experiencing any symptoms. We know specifically that the virus is most contagious around the start of symptoms, and so it's important for everyone to understand that the average time between being exposed to COVID-19 and developing symptoms may be 4 to 6 days, but the range of time that it could take before you start to experience symptoms is 2 to 14 days. So it's really important that we really practice social distancing, just like Congresswoman Sewell mentioned, in order to help reduce the spread of COVID-19. It's also important that we remember to avoid touching a surface and then directly touching our face, and that we practice great hygiene, like Congresswoman said, as far as washing your hands frequently with soap and water and hand sanitizer, as well as, if you feel symptoms, discussing them with your healthcare provider and self-quarantining yourself if that's what's necessary. I really cannot stress enough how important it is to remember social distancing in order to flatten this curve. Even though there are some people who may feel as though they're not likely to become infected, we do know that there are people that are younger than the age of 60, younger than the age of 40, younger than the age of 20, who have experienced severe illness with COVID-19 in this country. And we also know that some individuals in those age groups have also passed away from COVID-19. And so it's important to remember that no one is immune, and just because you may not show symptoms does not mean that you can't spread COVID-19, cannot spread COVID-19 to another individual. So please be mindful of yourself as well as those around you, and stay home if you're able to do so. I also want to mention that currently there's not a known specific treatment for COVID-19. There are some medications that are being allowed to be tested to see if they could potentially help treat individuals that are experiencing COVID-19. And there are also medicines that are being developed, as well as vaccines that are being developed. And we hope that those developments will show promise soon. But currently there's no known treatment for COVID-19. So it's important to remember that. My biggest takeaway point would be, if you don't need to leave your house to go to work, to care for a loved one, to please stay home, to social distance as much as you can, and to really make sure that we're all practicing good hygiene and making sure that we're washing our hands frequently and using hand sanitizer frequently, and remembering to check on those that are around us who may not have someone to check on them. Thank you, Congresswoman.
Thank you so much, Dr. Hill. Next up, we have Dr. McIntyre, who is the Chief Medical Officer for the Alabama Department of Public Health. Dr. McIntyre will discuss confirmed cases, test availability, and sites. Dr. McIntyre, you're live.
Thank you. Good afternoon. I wanted to give people a kind of a really quick overview of the what we've done in Alabama. We actually obtained the ability to be able to do testing at our state lab on March the 3rd. And then since then, we have been testing regularly. As of today, we have 982 people that have been confirmed to be positive. Those results are actually available on an interactive map that we have that you can get to by going to the Alabama Department of Public Health's website. On that same interactive map, it lists the deaths. We initially had just the confirmed, which are the ones that we've actually done a medical record review to actually determine that they did have a death related to the infection, the COVID-19 infection. And we are actually showing a total of 13 as of today. There are 23 deaths that have been reported as of today. And as we actually review medical records, the number that you see in 13 will increase as we get additional deaths being reported. In addition to the information that's available with the numbers, that's pretty much as close as we can get to real time, we also have a second tab that's available with the same interactive map that allows you to be able to get to test sites. We started out pretty slowly based on the fact that there were some problems with actually getting the materials that were necessary to be able to obtain the specimens. The biggest issue was getting the nasopharyngeal swabs in order to collect the specimens to submit for testing. We have actually been able to get those supplies in. As of last week, were able to get 10,000 nasopharyngeal swabs in, and we continue to try to order more. We put together 10,000 kits, and we've actually been sending them throughout the state to the hospitals and to these testing sites. As of today, we had over 50 testing sites that are available on the website. Now, those are not all of the sites that are within the state that are actually testing for COVID-19 or the SARS-CoV-2 virus. These are just the ones that are willing to be listed on the website, and when you click on that information and go over the little red symbol that has the heart in it, it will give you the address. It will provide to you the hours that they're operating. It will also tell you whether or not you need to actually call in advance. Some are doing what they call a pre-screen, so that they're actually scheduling for the next day, while others are actually taking people as they come and they do the screen at the same time, determine whether or not they meet the criteria for testing. Now, these sites are not all ones that are part of the Alabama Department of Public Health or the county health departments. There are some that are our sites, some that are actually have been established by some of the hospitals, that information is available there. We also have a number that we've been providing, and it is actually available the number 24/7. It's called the COVID-19 24/7 hotline. And they will actually give you information related to where the testing sites are. We do realize that not all people have availability to be able to get on the Internet to actually look to be able to try to find where those locations are. So if they call 1-888-264-2256, they will actually be able to determine where the closest site is to them. We continue to stand up additional sites. We are actually doing some now also with our county health departments and in various counties throughout Alabama, and we hope to actually be able to extend those sites as we get more and more availability to get the materials and the testing supplies out. And that pretty much gives you an idea of where we are. So we do have the capabilities. We have the materials to do the testing. We're actually performing testing not just at our state lab, but also there are a number of commercial laboratories and also hospital labs that now have the ability to perform the testing for COVID-19 to determine whether or not a person is infected or not. And that information and stuff is actually being added to the test results. We're not getting all reports, but we are getting positives reported to ADPH because it is mandatory that we get those reported. Thank you.
Thank you so much, Dr. McIntyre, for that information. And I'm looking at the questions that are coming in, and one is, what are the closest testing sites to Hale County, Greene County, Sumter County, and Perry County? I'm going to give you time to look that up. I do know that Hale County has a testing site at the hospital there, the regional hospital that is at the Hale County Medical Center, that has a testing site for sure. And so to give you a little time to answer that question, I will now turn to Secretary Fitzgerald Washington, who is the Secretary of Labor for the state of Alabama. Thank you so much, Secretary Washington, for being here this evening. Will you discuss how folks can apply for unemployment benefits? Talk a little bit about the waivers or relaxed requirements and the length of benefits and the type of benefits that one can receive. Thanks again for your participation tonight. Now, Secretary Washington, you're live.
Well, good evening. First, let me say thank you, Congresswoman Terry Sewell, for giving me the opportunity to update y'all on what ADOL is doing to provide information regarding the coronavirus. We are, no doubt, in unprecedented times in dealing with the current pandemic. Everyone is being challenged in ways never before. our hope is that we're looking at this crisis in our rearview mirror very, very soon. So let me touch bases on what ADOL has done since the outbreak occurred. ADOL has worked closely with our administration and USDOL on rule modification to offer assistance due to the pandemic. USDOL is treating the pandemic as a temporary shutdown, and claimants will receive benefits for a 3-week period. Since the crisis began, we've been answering a lot of eligibility questions. One of the things that we modified in our rules as it relates to unemployment compensation is the fact that if someone is medically diagnosed with COVID-19, you're eligible for benefits. If you're caring for an immediate family member who is diagnosed with COVID-19, you also are eligible for benefits. If you're quarantined by a medical professional or government entity, you're eligible for benefits. And let's just say if someone is sent home or laid off without pay by an employer due to COVID-19 concerns, they also are eligible for benefits. We waived the following rules. We waived the able and available requirement. We also waived the waiting week period. And we also waived the work search requirement. Just last week, we released a statement that waived employer charges for weeks claimed due to COVID-19. We didn't feel like the employer should be responsible with having a negative increase with their experience rating due to the coronavirus. We're also encouraging employers to file on their employees' behalf through our partial claims certification. We're also allowing employers to notify ADOL of their choice to opt out of their right for the request for separation information. In addition, we set up a new email and new fax number dedicated for the purpose of the COVID crisis. As far as our career centers throughout the state, and in particular, the career centers in your district, Congresswoman Terry Sewell, we closed the career centers and our central office to the public. Our central staff are working inside the career center, making calls to connect people that are looking for work. We also modified our online system to accommodate the surge in claims. Just last week, there were 74,000 claims taken last week alone, approximately 10,000 claims per week. So you can see that there's been a tremendous uptick with the number of claims that our staff has been filing. We do ask for patience for claim filers as we are experiencing high volume of people trying to file claims. Our staff are working tirelessly to meet the demands to process those claims. Also, we created a COVID-19 resource page on our website to include both state and federal information. We're going to continue to communicate with the public via media, website, and our social posts to let everybody know where these resources are. And Congresswoman, as you mentioned earlier, last Friday, the President signed into law a stimulus package that will add additional relief to more groups impacted by the virus. We're now working with USDOL for guidance on how we would administer those benefits to those who need the benefits. So each day we're waiting on that guidance so we can let people know where to access those benefits. And so finally, those of you who have questions, we want to direct them to our website, which is labor.alabama.gov, and then click on the COVID-19 resource page as it's being constantly updated with new information on available resources. So that's my update for right now.
Thank you so much, Secretary Washington. Next, we will have Dr. Eric Mackey, who is the superintendent of the Alabama Superintendent of Schools. He will discuss the reason for the school closures and plans to keep students learning and focus on those limited resources, limited broadband access. He will be discussing, Superintendent Mackey, you are now live.
Thank you, Congresswoman Sewell. I appreciate the opportunity to be here tonight and to say a few things about what's going on in our K-12 schools. And first, I'd have to say to all the folks in these 4 counties, thank you for your patience, thank you for your understanding, and thank you for your support for your schools. I have spoken with most of your superintendents personally in the last few days, and they have good plans in the works. I talked to one of them today about his plan for what they're doing during this interim time. So let me go back to the beginning. As the Congresswoman said, why did we get in this situation of closing schools? In consultation with public health, we began to realize several weeks ago that this wave was coming toward Alabama. And so we started planning 3 or 4 weeks before there even was a single case in Alabama. As you may know, we had originally laid out a plan that would only close schools sporadically around the state based on where there were outbreaks. But on the week of March 12th, 13th, we realized that our sister states were starting to have more and more positive cases. We saw what was happening in the metro Atlanta area, and of course that's just a short drive from parts of Alabama. And so we decided on the 13th that we would go ahead and close schools the next week. As you probably know, many of our schools went ahead and began closing a couple of days even earlier than the governor had required. But all that means that for a time we are out of school. Last week, reconsidering where we were, reassessing our situation in consultation with public health, we decided that it was better to extend that closure. We knew that there was no way we could come back April 6th. And then this is one of the most salient points. So we had the option before us to say close for just another week. And there were some folks, certainly some really good advisors who said, hey, let's just close for another week or 2 weeks and then reassess. And there were folks who wanted to close for the month of April and then reassess. But public schools across the state, it's such a big ship with about 20% of our population every day goes in and out of one of our public schools, including our students, teachers, staff, parents going to ball games, the bread man delivering bread in the morning. So we felt like we could not continue on kind of Band-Aid plans. We need to make a decision what we were going to do for the rest of the school year and then move with a consolidated plan. And so that's where we are now. We do have plans going forward. Again, your superintendents are working plans. We gave out some guidance on Friday morning. We had over 1,800 people on 3 separate calls Friday and another about 400 on calls today. We have more calls tomorrow. And these are when I say calls, they're conference calls like we're on now, but they're more interactive because we have curriculum directors who are posting questions and asking questions. And so we're helping them develop their plans. But we gave them a 4-page planning document that gives them some guidance to develop plans. With that in mind, one of the real issues in the counties that we're speaking with tonight is broadband access. So we have worked over the last 10 years and can now say we have strong internet connections, high speed, to every school in the state. But the next mile past the school, which is where we are right now, where we need to be able to connect from the school to the home, is still missing in many communities across the state. In fact, we know that 60% of our students don't have that high-speed connectivity at home and the proper devices they would need. The devices, believe it or not, are actually the easy part. They're expensive, but we could develop a plan to go out and buy computers, but they don't do us any good if we don't have connectivity. And there are many, many places across the state where we could be handing out devices this week if we had that home connectivity. So that is something with Congresswoman Sewell's leadership, I know she cares deeply about that and deeply about its effect on her community. And so we've had conversations already about how we can use some of the recently passed money from Congress to build out the last mile to make sure we have broadband access into every home. As far as the school system, what we're doing then is we're already working to get ahead of the next crisis that could be out there that would cause us to have to go to online learning, to build the kind of capacity we need to be able to make that switch immediately if we had the connectivity. So there are two pieces that have to be working in tandem. and we're working on both of them. For now, though, what we're doing is basically some old-fashioned pencil and paper. So, again, sending information home. We have the homework hotline, which is provided by the Alabama Public Library Service in connection with our department. People can call and get help with the homework. We have teachers that are calling to help students complete the packet. The only thing we are not allowing is that person-to-person, face-to-face contact between our teachers and staff and nurses and students. And that's, of course, because given the best advice of public health, we absolutely must maintain social distancing. It is difficult. There is nothing that will ever replace a teacher, a qualified teacher, and a child in a classroom learning together. That is the best and most wonderful option. But right now, unfortunately, it is not an option that we have. And so we're doing the best we can to close out this year. And I'll say one other thing about it, and that is that we're already looking forward to things we'll be able to provide this summer and next fall during the next school year to help students who don't close out this year well to get caught up and get ahead. And again, there's as the Congresswoman was wonderful working on our behalf, your behalf, and mine in Washington to see to it that we got $216 million in that stimulus package that's going to go to our schools distributed on essentially what we call the Title I formula, which means it won't be dollar for dollar and every child around the state gets the same. It will be focused on areas where there's higher poverty and greater need. And that's just a tremendous asset for us as we go forward, trying to make sure that we close any learning gaps and that we get every child caught up and ahead in this coming summer and the 2020-21 school year, so next fall. So that's my report, and I look forward to the questions. Thank you, Congresswoman Sewell.
Thank you so much, Superintendent Mackey. Really appreciate that overview. Lastly, we will hear about the census from Carletta Singleton, who's the partnership coordinator for the United States Census Bureau in Alabama, and from Mr. William Scott, a former staffer for this office and who's now one of the partnership officers on the ground in our district. Ms. Singleton, you're first.
Good evening to everyone, and thank you, Congresswoman Sewell. I want to thank you for this opportunity, and also to the other speakers that's gone before me. I want to say to everyone in the Hale County, Sumter County, Greene County area, the Census Bureau, is still at task. We are open for business. We have partnership specialists that are working from home, and we are on our mission to conduct the 2020 census for the United States. And we want to make it clear that you can respond by going online. Most people have already received their invite letter, and if you haven't received the letter, you will be receiving it soon. You can go online to respond to the census on the internet. And just following up with the speaker before me and the state superintendent, we understand that not everyone have access to internet or broadband in these counties. So we do make available an 800 number that people can also dial into and get assistance to complete their census over the phone. And there's a person available, and you give your address, and you can give your address and complete the questionnaire with the person that's answering the phone. So we want to make it clear that we are still taking the census. We have extended some of our operations in the field because of COVID-19. We are sheltering in place, so all of our field workers are working from home. We do have offices in Birmingham, and we have limited staff in those offices because of the sheltering in place and the social distancing requirements. But I want to say that we are still operating and we are still taking in the census. I am encouraged by the self-response and the online numbers and the response rates that we are already getting in the district. And those numbers are about 33.5%. And in self-response, what that means is people are responding through internet, they're responding. They may have received the questionnaire and they've already mailed it back, or they've used the 800 number to call in and complete that questionnaire. And you can go online at my2020census.gov. Again, online through internet, my2020census.gov, or you can call into the 800 number, 1-844-330-2020. 1-800-44330-2020. Give that number again, 1-844-330-2020. So for those persons who do not have access to the internet or don't have broadband, you can use the 800 number to dial in and take the census. So I want to encourage everyone for the district. We are already at over 50% of the residents and the households within the district already responding on self-response. So that's encouraging. And we realize that internet is not available everywhere, so a large number of the people participating is filling out the questionnaire and mailing it back. So we want to continue to encourage that. I want to take part of this time to give William Scott, who's been working diligently across the district and in these counties, to talk about some of the things that we're doing.
Thank you. I think it's critically important as we get William online that as we are sheltering in place pursuant to CDC guidelines, that we do take the time to fill out our census. There's no greater determinant of the amount of federal funding that we receive locally and we receive in our state than the census. And so many of the resources that we're receiving as a response to the COVID-19 in the various bills that I've outlined come to us based on population. And so we want to make sure that Alabama's 7th Congressional District is counted, because if we are not counted, we won't count when it comes to getting more resources for our public schools, our hospitals, our roads and bridges. It is critically important, even in this time of crisis, or especially in this time of crisis, that we stay sheltered in. But there are several ways that you can still fill out your census. You can mail it in, you can call it in, or you can, internet, fill out the application on the internet, all of which you can do from your home. So I want to now give our last speaker, William Scott, who will talk to us about the resources that are on the ground in order to complete our census. William?
Yes, thank you, Congresswoman, and thank you, Carlette, along with the other panelists. It's a pleasure to be talking to you about what's going on with the census, and I wanted to just follow up with what Ms. Singleton was saying to add a couple things. One would be is that the response rate currently in Perry County, so that you'll know where we are currently, is 19.9. Hale County, the response rate is 33.9. Sumter County, the response rate is 20.9. And Greene County, the response rate is 25.4. And so we just need to keep on working towards getting those numbers up, and that's as of 4:30 p.m. today. That's what the numbers are. And for the U.S., the census response rate is 36.2%. And for the state of Alabama, we're actually trending higher than the U.S. We're at 37.3%. And like one thing that Ms. Singleton talked about, and I wanted to restate it again, was you can go online at my2020census.gov. It's my2020census.gov. And the number again is 1-844-330-2020. The number again is 844-330-2020. And that'll be one way that they can complete their census and make sure we get a fast response on it. And the last thing will be is that we've been working with local leaders ever since 2018 with complete count committees in the district, Congresswoman, of over 22 complete count committees in each one of your counties and in a lot of your key cities. So we're constantly following up with those leaders from all the partnership staff under the leadership of Ms. Singleton to make sure that we build those relationships, keep them encouraged, and give them creative ideas. So thank you for the opportunity.
Thank you so much. We are now going to, Ian, open it up for questions. If you would read the questions in first name and the county or the city in which they're calling from. Could you ask the first question?
Will do.
Ian?
Sure thing. And a quick reminder, if you'd like to get email updates from Congresswoman Sewell's office, press 7 on your phone right now and speak to an operator and give them your email address. So I know we gave you a lot of information, but if you'd like to be consistently updated with accurate information, please press 7 on your phone right now. We'll get you on that email update list and make sure we keep you updated electronically moving forward. So 7 for emails. Our first question is going to come from William in Tuscaloosa, who's asking, he's a self-employed barber and wanting to know how to get compensation for unemployment. Congresswoman?
Thank you so much, William, for that question. You're self-employed, I understand, and I do know that the new legislation, the CARES Act, that was recently passed by Congress and signed by the President on Friday, will allow for those who are self-employed to apply for unemployment benefits. Secretary Washington, I don't know if you have anything more to add to that question.
Yeah, as I mentioned earlier, we still are waiting on some guidelines from USDOL on how we administer the CARES Act stimulus. But I can say that we will send out, actually we have sent out a communication that talks about how one can apply for the benefit. You need to go to our website, which is www.labor.alabama.gov, or you can call at 1-866-234-5382 and apply for those benefits. Now, the dollars for the stimulus has not arrived at DOL yet, but we're allowing you to go ahead and pre-file right now to start the process.
Very good. Thank you, William, for that question. I know a lot of folks have asked that question in the queue, and so as Secretary Washington said, the best way to apply or to get the information about how to apply, you apply online is what you do. It's labor.alabama.gov, and that phone number, 1-866-234-5382. Thank you. Next question, Ian.
Sure thing. Thank you, Congresswoman. Our next one's coming from Jacqueline, who's in Greensboro, asking, do individuals collecting disability qualify for the federal stimulus checks? Additionally, what are you doing to support rural communities not as equipped as the cities are? That one's from Jacqueline in Greensboro.
Great question, Jacqueline from Greensboro. The answer to that question is yes. To repeat the guidance that I gave before, we remember that this bill is hot off the presses, and so as Secretary Washington said, we're still getting guidance on how things will be distributed. But the intent of the bill, and the bill says clearly that Social Security recipients and Social Security beneficiaries, because of age, disability, or survivorship, are eligible to receive the direct payment. And so they will get what you're calling stimulus checks. They will get those checks. But you will have to do the guidance thus far from the IRS that is administering this. So just to be clear, these direct stimulus checks will come from the IRS, the Internal Revenue Service. If you do not file taxes, so if you are disabled and you don't make enough income to file income taxes, you will have to be required to do additional action by going to the IRS website and pulling down a short form tax form to fill out in order to make sure that you receive those that direct stimulus check. The question that will be asked of you is, what is your gross income, your income, whether or not you have any dependents, and what method do you normally file? Are you filing single or joint filer? And what method would you like to receive that payment, whether a check or direct deposit? And if it's direct deposit, your banking information. So to be clear, because the direct payment or the stimulus checks are being administered by the Department of Treasury, the IRS is distributing them, and Social Security beneficiaries and Social Security recipients may be required to do additional action. Please check our website. We should, as soon as that information is available from the IRS, we will post it. So you can check sewell.house.gov or go directly to the IRS, and that website is irs.gov/coronavirus. Thank you. Next question, Ian.
Thank you again. Appreciate you, Congresswoman. Thank you. Thanks, Jacqueline. Our next one's from Mike in Bessemer, who's asking, is there a bill that passed that you can get a 2-week paid leave if you have symptoms of COVID-19?
Very good question. Yes, the second bill that passed the House of Representatives and was signed into law, did provide for the very first time paid leave. The legislation that Congress passed requires all businesses with fewer than 500 employees and government employees to provide 80 hours of paid time or 10 days of paid sick leave to self-quarantine for those with a diagnosis or treatment for COVID-19. The guidance has further come down, and that guidance is that that it's only effective as of April 1st. It goes into effect April 1st, and it applies through December 31st, 2020. So that is true that there is paid sick leave, and that payment will be received through your employer. This benefit comes as a tax credit to the employer to be paid out to the employee through their regular payroll at their regular payroll times. Once again, this benefit goes into effect starting April 1st, and it is a direct payment through your employer is how you would receive it. Thank you for that question. Next question, Ian.
Sure thing. This one's from Sherry, and she wants to know, how can students who live in rural areas that don't have Wi-Fi access their schoolwork?
Very good question. Before I hand it off to Superintendent Mackey, I want to again reiterate that your Congresswoman is well aware, having grown up as a daughter of the Black Belt, of the lack of broadband in the Black Belt areas. And these 4 counties that are part of this cluster tonight, all of which have problems getting access to broadband. No one is working harder than I to get federal money down to the Black Belt and all of Alabama, and frankly, all of rural America. I truly believe that if we can get electricity to every hamlet and every village and every town in America, internet service is the new electricity, and it should be rolled out and available to everyone who needs it. And so we will continue to do that. There has been money put in block grants to the states for state usage in various ways to combat COVID-19. But I think if we know anything from this virus, we've learned that internet access and internet and broadband, not just critical infrastructure, but necessary infrastructure. And we're working to continue to do that. Superintendent Mackey, if you could address this caller's specific question regarding access to school work on the internet. Thank you, sir.
Yes, ma'am. I'm glad to do it. So in those 4 counties, it's going to be, almost impossible to have internet online learning. And so what we're doing is working pretty much paper and pencil, but I want to reiterate that's not just that area of the state. Actually, the vast majority of our students are not going to be doing online learning. We've used the term distance learning a lot, but we've been careful, or I've been careful to try to remind people, distance learning doesn't just mean it has to be online. Distance learning can mean a lot of things. So you're going to see a lot of paper and pencil coming out in the plans that your counties are going to be rolling out. Now, long term, I have to reiterate and just amen everything Congresswoman Sewell has just said. In today's age, internet, as she said, is just as important as access to electricity and clean water. I mean, it is basic to a basic part of our society. And so I'm always looking for that silver lining. People who know me know I'm an eternal optimist. And I would say if there is anything good that can come out of the horrific public health crisis that we're dealing with right now, it's that we will hopefully realize as a country and as a state that we have to build out that last mile and get internet to every home. If we had internet in every home, you would see a completely different learning plan being rolled out now across the state. But again, most of our state just cannot do that. And if I could say one other thing, and that is, if you do have internet, though, there are so many great resources out there, and we are posting those on our website. We have excellent both private and public vendors who've come in and said they'll offer free products to students. So we're collecting all those, and we can share those. You can go to our website and see them if you do have internet access there's lots of good stuff out there that we can offer for enrichment.
Thank you, sir. We have time for one more question, Ian. One more question. Last question.
Sure thing. We've got this one from Miss Mary Rebecca Chambers. Thank you, Mary. Her question is, how can I receive my census form? I have not received one yet.
Very good question. I don't know, William, if you'd like that, or Ms. Singleton, if you would answer that.
Thank you for the question. If you have not received your questionnaire, the questionnaires are going to be mailed to everyone across the U.S. and across each county between April 8th and April 20th. So the mail invite has gone out, and in some cases, in rural areas and areas that don't have access to internet, some people have already received the questionnaire. But in a few days, about a week, everyone across the U.S. will start receiving that questionnaire. So as soon as you receive it, just fill it out and mail it back. And then also, you can go out online. If you don't have access, use the 800 number. Our partnership specialists are available to assist people. We understand that people have reservations about the questions that are asked on the census. So if you want to talk to a partnership specialist, we can make our partnership specialists available to you. You can text me at 205-983-4992. Again, that number is 205-983-4992. And I can have someone contact you to help you with getting familiar with the questions so that you're prepared to fill out the questionnaire.
Thank you so much. Thank you, Ian. I want to thank our presenters tonight for participating in our telephone town hall. And I really, really want to thank the over 2,000 residents of the 4 counties that called in to our Congress in Your Community Tele-Town hall meeting. I think that in this day and age where we live in unprecedented health challenges, it's caused not only unprecedented economic challenges, but also unprecedented communication challenges. And we're trying to meet those needs while still communicating with our constituents as to best practices, what they should know about COVID-19, and most importantly, how they can stay healthy themselves and their families, as well as our community, as we continue to try to contain this COVID